One of the key challenges in the response to the ongoing Bundibugyo Ebola virus disease outbreak is that the outbreak is spreading faster than the response in the Democratic Republic of Congo. This trajectory, if not reversed, has serious implications for the control of the outbreak and dire health and socio-economic consequences, not only for DRC, but for the entire continent and beyond. The disparity in the spread and the response and the consequences therein reaffirms a repeated lesson from many outbreaks. The lesson is that an outbreak is essentially a race between the pathogen and the response. Whatever side moves faster wins. In outbreaks, time is not neutral. Every day that passes without action gives an advantage to the pathogen. Every delay in response allows the pathogen to move through families, communities, and across borders. Conversely, everyday gain in rapidly deploying effective interventions interrupts transmission early and prevents a localized outbreak from becoming a national, regional, or global crisis. The effectiveness of a response correlates very strongly with the speed at which interventions are deployed. Speed, which is the ability to act quickly or the ability to transform time into action, is therefore our greatest ally in emergency response. It is a force multiplier and amplifies the effectiveness of every other intervention. For example, community engagement is more effective before rumors gain roots. Vaccines are more effective when deployed early. Contact tracing is more effective when initiated immediately. Clinical care outcomes are better when patients present early before the disease advances. A rapidly detected case can prevent a dozen more. A rapidly investigated alert can interrupt a chain of transmission. A rapidly mobilized response can prevent localized outbreak from becoming a national crisis. And a rapidly coordinated regional response can prevent a national emergency from becoming a continental threat. A speedy response saves lives, protects economies, preserves trust, and strengthens security. The difference between containment and catastrophe is often measured not in months or weeks, but in days and sometimes in hours. Speed is the difference between vulnerability and resilience. And ultimately, speed is the difference between lives saved and lives lost. Conversely, the value of every intervention diminishes with delay. The pathogen needs one thing to overrun and outsmart the response, and that is delay. A delayed alert can be a missed opportunity. A missed opportunity can be a missed case. A missed case can be a chain of transmission, and a chain of transmission can be a crisis. Speed is therefore not only an operational tool, but a strategic imperative. Speed in detecting threats, in sharing information, in making decisions, in mobilizing resources, in engaging communities, and in coordinating response must be core in health security discourse and emergency response, and should engage the attention of public health leaders, policymakers, and partners. In every outbreak, we must move with the full force of speed. But there is a fundamental truth here. Speed during crisis cannot be created instantly. It must be created long before the first case arrives. Speed during crisis is usually a product of deliberate strategic investment in people, processes, systems, and structures. It is built through investment in surveillance systems that detect cases early. It is built through laboratories that confirm cases quickly. It is built through trained health workforce, field epidemiologists, laboratorians, infection prevention and control professionals, community health workers, and other rapid responders who can be deployed at a short notice. It is built through trusted communities that report unusual events and partner with health authorities to respond to them. And above all, it is built through leadership that recognizes that preparedness is not a cost, but an investment in national and regional security. Outbreaks reveal the strength of our institutions, the readiness of our workforce, the trust we've built with our communities, the strength of our partnership, and the adequacy of our preparedness before the emergency. Indeed, speed is our greatest ally in outbreak response. I thank you.